pleased to be joined today by Susan Pigott. Susan is a trained nurse and social worker and has worked in health and social services for over 35 years. She was the Vice President of Communication and Community Engagement at the Centre for Addiction and Mental Health, where I work. And recently she's been the chair of Ontario's Mental Health and Addictions Leadership Advisory Council. She's quite active on boards of many community and arts organizations, is a generally very active person in things related to health and social services. Welcome, Susan.
Thanks, Rob. Pleased to be here.
Susan, I'm wondering if you could start by talking a little bit about why the council was created and what its goal has been over the last few years.
6 years ago, the Ontario government, specifically the Ministry of Health, developed a 10-year mental health and addiction strategy. And the first 3 years were led by the Ministry of Children and Youth Services and focused mostly on services for young people. 3 years ago, the reins were handed over to the Ministry of Health, who decided that they would focus on the entire mental health and addiction system. And the Minister of Health, Dr. Eric Hoskins, decided to set up an advisory council to provide him with advice on how to build a robust mental health and addictions service system. So that was our job.
The council's latest and final report, or last report, is called Realizing the Vision. Would you talk a little bit about what that vision is or was?
We worked for 3 years. Every year we would submit a report to the Minister of Health. The last report, which was submitted this past November, was really a culmination of all the work we'd done. In all our reports, we tried to bucket our advice into 3 areas. Firstly, we talked about health promotion and prevention. And our point was that creating an environment in this province which promotes mental wellness is the job of the entire government. It's well beyond the purview of just the Ministry of Health. So we were very pleased about 7 or 8 months ago when the Premier set up an interministerial committee of Cabinet on mental wellness. So this means that things like adequate income, gainful employment, stable adequate housing, all the things that we know are so important in promoting mental wellness and helping people who are ill recover, has got a champion at government. So we had a number of recommendations for them. We even developed a framework to help them organize the work that each ministry could do. The other 2 buckets in our report were focused primarily on the Ministry of Health and the Ministry of Children and Youth Services, because the sad fact is, as you well know, Rob, there are hundreds of thousands of people, adults and children in this province, who are not well and they're not receiving the kind of services that they need. So we talked about the kinds of things that are needed over the longer term to transform the system, among them making sure that in each LHIN, in each local health integrated sort of area of the province, there's a core basket of service, same in Sudbury as it is in the Soo, as it is in Sarnia. We talked about the need for a data strategy so that we can measure the improvements that we're making as a system. We don't have one now. We have random data collection. These 2 recommendations were frankly based on the kind of recommendations that were made by Cancer Care Ontario in the early days, maybe about 25, 30 years ago, of the transformation of our cancer system. And it's worked. We have an excellent cancer care system. We need to get our mental health service system there. We also talked in terms of systems transformation about the need for funding reform. Their funding patterns of mental health and addiction services are kind of locked in time. These are recommendations that are absolutely necessary for systems transformation, and we know they're going to take a few years to be implemented, but we're happy that as of 2016, the data strategy and the core services work has been started. Finally, the last sort of bucket were recommendations around critical gaps in service right now. And in this area, we have the need for structured psychotherapy, publicly funded. These are things like mindfulness and cognitive behavioral therapy. These are new therapies that are proven. People want them, but they're not publicly available. As of 2016, the government has started to implement slowly structured psychotherapy pilots. We also talked in the third report, as we did in the second one, about the need for there to be easy access for young people to mental health services. And as you probably know, last year, the implementation of youth service hubs commenced under the leadership of the Ministry of Health and the Ministry of Children and Youth Services. So this is great, and we want to make sure that that continues to happen. We also identified the need for more supportive housing. This is a huge problem. Each year we chip away at it, but there are approximately 30,000 people who need supportive housing. So those were some of the sort of critical service gaps that we made recommendations. I have to say we don't know what's going to happen to our year 2017 recommendations, but the ones we made in 2016 have largely been acted on, so that's very, very positive.
Susan, you mentioned in the intro to the report that you had 2 reference panels. Can you tell us a bit about those panels, who they were, and how they contributed to the work and thinking of the council?
We were determined that we were going to be informed by people who had direct experience with the mental health and addiction service system, both as patients or clients and as family members or caregivers. So we set up 2 panels, 20 on each, people from across the province. One were service users and the other were caregivers. These were people who received some orientation and training. They, of course, come to the table with their own experience, but we made sure they understood the context in which we were working and some of the policy considerations. They were paid for their contribution, and they were brought in about 5 times a year in the second and third year to both provide us with input in terms of the issues that we should be addressing and also to comment on our recommendations. A lot of our recommendations actually grew out of our discussions with these 2 groups. The whole thing worked extremely well. The evaluation feedback from both panels was very positive, and I am convinced that this is the way that modern public policy should be done. I think the days of having experts in the field just come up with public policy, particularly with regard to healthcare matters, is gone. I think we have to take our lead from the people who actually have an intimate experience with the service system.
What's the biggest thing you learned in your work with the council?
I learned that when there is an opportunity provided by government for people who work in the field, both in the community and in the hospital sector, to try and make a difference, people are by and large able to put their self-interest of their organizations aside and really work towards systems transformation. It was very heartening to see. We didn't have much turnover on the council, and it was onerous. We had working groups. People probably came to meetings at least 10 days or 12 days each year, full days. And when you're talking about people who have full-time jobs on top of that, that's a lot. And people were very generous, leaders in organizations, about putting the resources of their own organizations at the service of the provincial government, which was another very, very pleasant surprise how generous people were in that way. And I think it's a real lesson to government that it's important for the civil service to work with partners in the field, because the partners are close to the ground and they have the expertise that government often doesn't have, and they're willing to be collaborative. So it's an extra resource that I don't think governments make use of enough.
Now that the council's over, do you have any thoughts, some hopes or expectations about how the good work of the council might be continued?
Well, we did make a recommendation in our report that there be an outside of government body created to be able to maintain a focus on systems transformation. We aren't expecting necessarily something of the magnitude of a Cancer Care Ontario, But the need for an outside body to inform and keep the mental health and addictions issues in high priority with government has been identified many times by other groups, most recently the Select Committee back about 8 years ago, and we made the same recommendation. So I'm hopeful that this may come about.
Okay, well, thank you, Susan. Thank you for taking the time to talk to us today, and thank you for your leadership on the Mental Health and Addiction Leadership Council.
Well, thank you, Rob. Thanks for your interest.